including for buying of and distribution of condom, was lost. Number two, a lot of donors, and this is very important, a lot of donors have declined to continue providing condoms to Kenya because the government has several taxes for importing and distributing condoms in this country, including clearly labeled free for distribution, not for sale, free for distribution. So we are aware that there are several donors who would be willing to provide a significant amount of free condoms for this to distribute in this country, but the taxation is a major barrier. And finally, the national government support to the condom programs is also on the decline. And as a result, it is exposing the most needy population in this country. The most needy. They are not needy because they don't work. They are very hardworking. It's not they are not productive. They are very productive. They are important for this country. However, among all the competing interests, from school fees, from food, from housing, from other health needs, condom is also necessary to be included. So what is our request? Our request is the government to reinstate a budget for free condoms to ensure that we protect the most vulnerable among us. Number two, to have a very clear waiver mechanism to remove all taxes and other barriers that stop stakeholders, donors, and philanthropists in this country and outside this country from bringing into the country free for distribution condoms that are availed through the hospitals, through our private, through our public system, and through the hospital, available to the most needy. So those are our requests, particularly on this day. We appreciate the efforts done, but we decry this unacceptable lack of condom. In particular, these are when we are looking at the festivities. We know that during the festivities, we expect plenty of tourists within the country and in particular parts of this country. The coastal strip, Mombasa, Diani, Kilifi, and so on, they expect a lot of local and international. And I'm emphasizing local because the greatest number of tourists in this country are not international, they are local. And they'll go to the coast, they'll have fun, but we worry at what will happen there or what they import home if the condoms are not available. We know the other methods can be used for prevention. However, these methods are not as effective as condom and are not as accessible as a condom. And most of the Kenyans do not even know how to use those other methods. So we want that the most effective method be availed to Kenyans so that they can use it, protect themselves, and have fun without regrets. Thank you. So I think that's all I wanted to say. And maybe if there are questions I can take. And I'm certain that the press release printout will be available to all of you. So Kevin, as we stand right now, the condom shortage is biting every single county in this country. And most of the dispensers, and I'd like to encourage you and the other colleagues here to visit these condom dispensers because they are in public places, markets, strategic places, in the bars and so on. And you'll find that they are empty. Our greatest concern is the areas where we know we have high HIV prevalence, like the counties in the Lake region, Kisumu, Siaya, Homa Bay, Migori, are now extending to our what we call shemejis in Kakamega and Bungoma. On the other side, we know that we have lots of troops of tourists headed to Mombasa, Kwale, Kilifi, and we know that the cities are always areas of high activity. We all know about Vasha. Plenty of us are planning to head to Naivasha. This was the festive season. Nakuru now city and Nairobi. Those are very high risk counties, and therefore without condoms we are looking at very serious problems, both for teenage pregnancy, for STIs, and for HIV infection. Let me turn to my other colleagues on question on the cost. The actual budget, I'm going to give you the actual numbers as soon as I have my my reference document availed, but the actual number, quoting this year's 2021-2022 budget, is 23.3 billion Kenya shillings. 23.3 billion Kenya shillings. That is for HIV only, because we are talking about, yes, thank you for bringing the paper. Yes, I can give you the exact number now. Yes, is can write. So it's 231 20 35628. That's the exact figure. Now, this figure constitutes the following, which are commodities for control, where we have the ARVs for both adults and children. We have the lab reagents that are necessary for testing, initially for the initial test and follow-ups. We have other lab supplies that are necessary, but we also have drugs for PrEP and PEP, pre-exposure prophylaxis and post-exposure prophylaxis. In addition to that, procuring these drugs, storing them and distributing them is also a cost. So that is also included there. Million condom is a need. Vis-a-vis the amount of condoms the government is able to bring in, which is 150 million. In terms of condoms shortage, it has been an ongoing challenge for the last 2 years, but this current year is when we've had now the dispensers running dry. Like we are speaking right now, no condoms, completely no condoms. The issue is not that the supplier being either one or two. There are many suppliers. The market has adequate supplies. The issue is, like I mentioned first, is the donors reduce the amount of funding they were putting in. And I looked at USAID, USG plan for for up to 2030. They have zero money for condoms. And because we were classified as middle income country, so it means that the government has the muscles, should have the muscle to step into that space. And the government has not been able to do that. Also bringing support budget from government. And then finally, the taxation that have chased away the donors who are supplementing the government supply. So as far as I'm concerned, the easiest, the lowest barrier to deal with, because that's a policy issue that the government can be able to make, looking that the amount of tax they are gaining from condom is so little compared to the gains they can get by allowing the condoms to come in. The tax that we are getting, if you compare to the risk that we are putting our country and our countrymen in, and to the economy, because every person we lose is a person is a loss of income. Because each one of us here, our government, that's why it's not even allowable to hang. We are what? We are part of the government machinery. We are government economy. So every person is necessary. So if we lose them prematurely, government loses all the labor and economies that each person would have brought to this economy. So the tax is really, it really does not make sense maybe to us. It would not make sense to the economists if they sit down and looked at the benefit versus the tax that we're getting. That is ongoing. It's actually significant amount of the ARVs now, particularly the first line, we call TLD, is local. And which has helped in terms of turnaround from when you order to when you receive them, because you don't have to receive the entire batch. You can receive as hot as they are leaving the production, which is good. But the local production of condoms has been a long and winding and painful route. And several manufacturers have wanted to set foot in the country and have found it difficult. Also owing to government bureaucracies, I would say, without going into details. But details are there. What I would like to say is that I'm happy that our sister country, Uganda, is now, from this year, producing condoms. And we are in high gear trying to see, because these ones are produced within the COMESA, can the taxes be waived? Because that can alleviate a lot of the pains that we have. That does not mean that there is no room for local production, because even the Uganda one will struggle to meet the needs for East Africa, the expanded East Africa region, knowing we have DRC coming on board. We are looking at nearly almost a population of nearly 400 million. Yeah, if you add Ethiopia there, we'll be headed to almost 700 million people. So a local production will be perfect. That's what I'd like to say. But that may not obviate the price, because even with the local production in ARVs, we are noting that the price is still high because there's still taxation on the raw materials that are coming in. So there's still need to rework our taxation, particularly for such vital commodities. Yes. Yes. So this is like a third of the condoms required. I think the details, other details, you'll find them in the press release.